Goodlow, Medical Director for the EMS System for Metropolitan Oklahoma City and Tulsa. And let's talk about changes in spinal motion restriction. You know, for 30 years plus in EMS, we've been using these and these with nothing but good intent, trying to prevent secondary spinal injury after someone may have experienced a very serious head, neck, or back injury. And the fact of the matter is, while we've done that with very careful attention to detail, what we've actually done is we've done that based on tradition and not evidence-based medicine. One of the real exciting things about EMS medicine in 2015 and beyond is that now more than ever, we understand the benefit of making our decisions on good data and not just because it's something we've always done. So while there's still a role for this, we're going to find a lot less use for these backboards. In fact, I want you to think about using these backboards that we have traditionally used as immobilization devices, and instead think about them as mobilization devices. And you're going to see some excellent examples of that follows my comments here. So how do we apply the science and actually put it in the street in a day-to-day basis? Let's talk about that. So we apply the evidence-based science in this way. Number one, use common sense. And that may seem like such an oversimplification, but the fact of the matter is, think of all the patients that you have applied a C-collar and put on a long spine backboard and applied head blocks and taped and strapped that patient down, and the whole time you're doing it, you're thinking, this is overkill. The reality is, you're right, and you have been right, and now the science is catching up to your common sense. So we still very much care about the integrity of spinal alignment, but the reality is, in the conscious patient, their own musculature and ligaments next to that spine are doing a lot to preserve spinal alignment. So let's carefully apply a cervical collar and let the patient help themselves and just maintain some good, common sense, neutral spinal alignment. Secondly, don't overthink the situation. So if a patient likely does not have a spinal injury, use the decision algorithm that we've already had in place and many other EMS systems have had in place, utilizing the Nexus studies and the Canadian C-spine rules, so that if we don't have language barriers, if the patient is awake and alert and able to make good decisions and let us know where they're hurting, and they don't need spinal motion restriction in the first place, well then let's not use spinal motion restriction. And so utilizing these techniques that you're about to see, it will keep the patient safe, it will keep the patient more comfortable, and it will keep us all practicing good evidence-based medicine. Thanks for your attention. questions that comes up is what exactly do we mean by spinal motion restriction, and how does that differ from spinal immobilization? So classically, in EMT school, we spent a lot of time in spinal motion immobilization or spinal immobilization. And think about the hours and hours you practiced getting somebody on a backboard, already in a C-collar, and taping them down, and patting all the crevices, and all of those things, right? Remember turning your instructor upside down and hoping they didn't fall off the board? That's spinal immobilization. Spinal motion restriction still very much values maintaining the integrity of that spinal alignment. So if a nurse or a physician or someone else says, have you guys suddenly quit caring about spinal injuries? Absolutely not. Just getting smarter in using the right tools that really make a difference. Because the reality is, all along, have we really been spinally immobilizing folks? Because even though we have done our best efforts to get somebody on a long spine backboard and tape them down, could they really still move that neck? You and I both know they could. So this is just thinking smarter, and it's still valuing the prevention of secondary spinal injury. That's what spinal motion restriction is all about. And frankly, it's even safer for the patients, because also in some of these circumstances, you'll see patients on their own strength pivoting out of cars and being moved to stretchers. And that's going to reduce the chance of lifting injuries for you and your patients. It's all about thinking smart, and it's all about keeping safety in mind. One of the great things about our EMS system is we are 4,200 EMS professionals strong, serving over 200,000 people a year. And I want to particularly thank some of the professionals in our system from the Yukon Fire Department and the Emergency Medical Services Authority today in helping us produce this educational video. Together, we make a difference. Thank you for your attention.